Okay, so I'm Dr. Consulter. I'm the medical director for NeuroMedici. I've been working with the staff for years already. We were previously working with the medical cannabis, and we still are, and now we add infusions of ketamine for protocols on psychiatric disorders as well, pain disorders. So what we start doing at NeuroMedici with the ketamine infusions, and the ketamine infusions that we use for respiratory depression, severe anxiety, and obviously complex post-traumatic stress disorder. We want to reintegrate the patients back to society through the use of ketamine plus professional help. What we are proposing to the patients is a resetting protocol, or we're going to reset your brain, your neural cells, and we're going to increase connectivity in the areas of the brain where your neural function is not appropriate or is not working well at the moment for several reasons, either because of trauma or because of addiction or even physical trauma and pain, chronic pain. And the patients have to have their blood pressure controlled before they come in, and they have to have literature assessment themselves about what to expect. And we also teach them what to expect and how to go and how to behave. And we have metrics during our initial assessment, which we categorize patients in terms of mental health and pain assessment. And then afterwards, we have the numbers, and then we start the protocol and then reassess the patients after a few infusions, and we notice, when we're noticing responses, incredible response actually in the first infusion, which made us really happy. The reason why we opened NeuroMedici was to support our patients who were already on clinical marijuana, in the medical cannabis, and also using traditional medicine, traditional chemicals, who are not responding for major psychiatric disorders, mental health disorders, and chronic pains of all sorts of origins. We do believe that the use of infusion that we do at NeuroMedici, which is the ketamine, it's a safer, simpler, and less addicting way of dealing with chronic maladies like chronic pain and depression, respiratory depression, post-traumatic stress disorder, and addiction as well. With protocols, we have set protocols for pain and set protocols for mental health. However, it does really varies from patient to patient and case to case. Some patients will need 3 infusions, some patients will need 6 infusions, some patients with 1 infusion, and you see the results already. You see it coming. So it really goes from patient to patient. We always start at the minimal dosage, and then we increase if it's necessary to achieve a clinical goal. Then after the sessions are over, the initial sessions, then patients will have booster infusions every 4 to 6 to 8 weeks, depending again from patient to patient. The ketamine patient, the ideal patient will be patients willing to work with us in the long term and work with their mental health providers as well, like the clinical social workers, psychology, and their psychiatrists, in a way that we can form a protocol all together, and we can see the full effect of the ketamine infusion, plus subject the patient improvement towards society and their own lives. So we believe we can make patients more functional and accepting of their symptoms and tolerate life in a different way.